Hello, nursing class of 2018, and whoever's watching. So today we will go over chapter 22, abnormal findings, pages 621 to 629. On page 621, atrophy is loss of muscle mass caused by disuse of muscle damage or motor nerve damage, along with axillary nerve palsy. Dislocated shoulder, anteriorly forward, is the most common at 95%, and this occurs with trauma involving abduction, extension, and rotation. Joint effusion is swelling from excess fluid in the joint capsule, here from rheumatoid arthritis. So a common cause is rheumatoid arthritis, an inherited disease. Fluid present will cause visible distension. Next we have a tear in the rotator cuff. Hunched position with limited abduction of the arm occurs from traumatic abduction while arm is held in abduction, or from fall on shoulder, throwing, heavy lifting. So this can be determined by a rotator cuff positive drop arm test. If the arm is held passively abducted at the shoulders, the person is unable to sustain the position, so they'll have pain and they'll drop their shoulder, and that's a positive sign for the drop arm test. Next we have page 622. Frozen shoulder, aka adhesive capsulitis, is fibrous tissue from the joint capsule causing stiffness and limited motion with increased pain. Prolonged bed rest causes this and may heal naturally. So if you're just laying in a bed, for prolonged periods, say you have to be in the hospital, your shoulder, I guess you can look at it, will be frozen like a supernatural kind of movie where a hero is frozen and comes back to life. It may come back to life naturally and need no treatment whatsoever. Subacromial bursitis is inflammation, swelling of the bursa over the shoulder, causing limited range of motion and pain. This is caused by repetitive motion, inflammation process, trauma, strain during sport. So pitchers may get this. Olecranon bursitis is a large goose egg at the elbow, and it really does look like a goose egg, like a big bump. And it's easy to see because bursa is fairly superficial. Gout arthritis is joint effusion, synovial thickening around the elbow, limited extension of the elbow. The arm can't go 180 degrees, and it's a bump, but it's not as distinguished as olecranon bursitis. Okay, so now on to page 623. You have subcut nodules, raised firm, non-tender nodules on the surface of the arm, occurs with rheumatoid arthritis. Epicondylitis, aka tennis elbow, which is chronic disabling pain at the lateral epicondyle of the humerus, head of the bicep bone, y'all. With extension, pronation, supination of the forearm, the back and forth motion, from like playing patty cake, or of course racket sports such as tennis elbow, right? Ganglion cyst, which is a nodule on the wrist, the back of the hand. More noticeable when you bring your palm to your elbow. More common in women aged 30 to 60 years old. Can be either cosmetic concern or painful one, causing numbness, tingling, or weakness. So then you have Colles fracture, which is a non-articular fracture of the distal radius. Common cause is fall on the hand, most frequent in older women. Carpal tunnel syndrome, with atrophy of the thernal eminence of the wrist. It's caused by repetitive motion, most common in women aged 40 to 60 years old. Signs and symptoms include pain, burning, numbness, atrophy of the thernal muscles. Yeah. Okay. So on page 624, you have ankylosis of the wrist. Extreme flexion with ruptures of wrist extension caused by rheumatoid arthritis, functionally compromised hand. A Dupuytren contracture, commonly in men older than 40, is most often bilateral. Chronic hyperplasia of the pulmonary fascia can be caused by diabetes, epilepsy, and alcoholic liver disease. Next, you have swan neck, which is a abnormality in the finger where the neck of a swan is resembled because the flexion at the metacarpophalangeal joint, the first one is flexed, and the next one is hyperextended. So it's like a strict arc and then a curve, if you can imagine, and it looks like a duck's neck or a swan's neck. And Boutonniere's deformity is similar to the swan's neck because of the hyperextension and flexion of those two same joints, but it's the opposite because the opposite joints are flexed and extend and hyperextended. It's flipped. So the ulnar deviation or drift, fingers drift to the ulnar side because of stretching of the articular capsule. They drift out, caused by rheumatoid arthritis. And by this point, you gotta ask yourself, how many conditions are caused by rheumatoid arthritis? Anyways, I digress. On page 625, we have osteoarthritis. Different from RA, osteoarthritis is caused by non-inflammatory nodules 2 to 3 millimeters or more in length. They're little bumps on your finger, page 625 if you need the visual. They're also called Herbinden's nodes. Osteoarthritis, Herbinden's nodes. OAHN. OAHN. If you need a mnemonic. Distal is more common, and Burkhardt nodes, distal interphalangeal joints, is less common. So the closer joint is normally where the nodules will be found. Remember to use both thumbs by thumb dually. Okay, when assessing the hand for Herbinden's nodes, which are more common. So acute rheumatoid arthritis is painful swelling and stiffening of the joints. Fusiform swelling is usually symmetric. Hands are warm, veins engorged. You know, you cannot see the veins because they're so engorged. Think of like a mozzarella stick. If you've worked in a mozzarella stick factory like I have, this might be relevant. So the mozzarella stick, before it's breaded with 3 layers, it's just a long string cheese. But then as it's breaded and deep fried, it becomes this thick masterpiece of deliciousness. So the acute rheumatoid arthritis could be known as the thick cheese slab of deliciousness. And that's how you could remember that. Also remember that it's inherited. Polydactyly is extra finger, which is so neat. In my opinion, does polydactyly, does that sound like a dinosaur? Kind of sounds like a dinosaur to me. I must be thinking of pterodactyl, but it's an extra finger, which is surgically removed for cosmetic appearances. In my opinion, that's kind of lame, not to get off on a tangent, but I guess, you know, it would be different or weird to have a 6th finger, but if you had a 6th finger, That could almost be a superpower. Like you could have a larger basket for a bigger handful when grabbing snacks. Like, oh, can I have some of your Chex Mix? I noticed you opened a bag and I'm naturally flocking to it. Can I just have a handful? You have an extra finger for more Chex Mix. Unbelievable. I digress. Synodactyly, not to be confused with polydactyly. Synodactyly is webbed fingers, like a duck, but not at all like a duck, because ducks don't have hands. They have like wings or something like that. Synodactyly is an actual medical problem, leaving the fingers fused and would limit flexion and extension. So it's not lane to get these unfused, disfused, separated. You gotta keep them separated. So page 626, Osgood Sclatter disease, painful swelling of the tibial tubercle just below the knee, probably from repetitive stress on the patellar tendon, occurs most in puberty during rapid growth and most often in males. Pain increases with kicking, running, biking, or kneeling. Okay, so it's the Osgood, all is good. It's the altar boy's disease because when the altar boy grows during puberty, he has trouble kneeling to pray. Osgood, all is good. Altar boy's disease. Osgood splatter. Post-polio muscle atrophy. So the right leg and foot muscle atrophied as a result of childhood polio. With polio, vaccine is mostly eradicated. You can see the image of this on 626, but one leg is lacks muscle while the other leg has defined muscle. So someone skipped half of leg day, I suppose, to be silly. Mild synovioitis is loss of normal hollows on either side of the patella. Occurs with synovial thickening or effusion, excess fluid. Also note mild distension of the suprapatellar pouch. Prepatellar bursitis, localized swelling on the anterior knee between the patella and the skin. Overlying skin may be red and shiny. So page 627, swelling of the meniscus, localized soft swelling of the cyst and lateral meniscus, shows that midpoint. Semiflexion of the knee makes a swelling more prominent. Achilles tenosynovitis, or Achilles heel, inflammation of the tendon sheath near the ankle, Achilles tendon. Movement causes pain, so if you remember the Greek parable about Achilles' heel and how he was a great fighter, but his heel is what caused him to lose and be defeated. So tofu with gout. Tofu like tofu. I'm sorry to my vegetarian friends and fans of soy, but they look and sound similar. Tofu with chronic gout of the big toe. You can see this on 627. It's like tofu, or like a weird looking wart with asymmetric borders. This it causes pain and acute gout, which is on the big toe again, is redness, swelling, heat, extreme pain. Episodes involve alcoholic intake, dehydration, poor diet, too much. It's actually cool. It's from uric acid, a nitrogenous waste. By the breakdown of muscle, you get this, and it's the king's disease, gout, because you eat too much meat as a king. This is why that is. That's why this is. I digress. So 628, Hallus valgus, with bunion and hammer toes. Hallus valgus, from RA, Hammer toe deformities in the second, third, and fourth and fifth toes. Corns develop on the dorsum over the bony protuberance from prolonged pressure from shoes. Callus hypertrophy of the epithelium develops because of prolonged pressure. The condition is not painful and is common with like runners, bodybuilders, whatever. Ingrown toenail, the area becomes infected. The nail grows inwards to the skin. Plantar's wart is vascular papillary growth and is probably caused by a virus. Occurs on the sole of the foot, commonly at the ball. The condition